Yes. Yeah. Okay, thank you, Tristan. We're not. Okay, you're live, you're good.
Okay.
Which,
Let me start by saying, as usual, this meeting is being audio and visually recorded. This is a special meeting of the Board of Health taking place on September 10th. To discuss something that needed its very own sort of space, because there's a lot to think about and a lot to discuss, and that is the septic system nitrogen loading credits in the nitrogen and pathogenic sensitive areas. First, let me ask if there's any public comment before we sort of begin with the discussion. Okay. So this is a follow-up. We've gone over this several times. It's clearly of great concern, I think, to the Board of Health, and should be of concern to the entire island of Nantucket. We put a moratorium into place in June to not allow any variances because we thought that we needed to discuss this much deeper and get more information and think about it more carefully. And also because it seemed like it was a constant thing. Over and over and over, we were being asked for variances in the two areas where variances are possible, which are the Nantucket Wellhead Protection District and the Hummock Pond Protection District. As most people know, perhaps, that the Nantucket Harbor Watershed Protection District and the Nantucket Harbor Protection District, no variances are permitted or possible. So we're really concerned, I think, today about those two districts, the Wellhead and the Hummock Pond. Let's just start by seeing who has, we've got a lot of information here. We've been sent a lot of things. John did a wonderful summary. I thought that I printed out for all of us just to have a copy in front of us. I think we can, use that sort of as a jumping off point, because it explains a lot of things pretty darn well. So who would like to lead off? Any of us want to talk about this?
I'm willing to start.
I'm looking at you, Gary.
Well, I always got something to say, I guess. And I know we talked about this before a little bit, but I mean, the goal from a Board of Health perspective is to protect the water supply. It's not about development. It's not about, that's out of our purview, but we want to protect our single source aquifer. So, our actions should reflect that support working towards that goal. We have had discussions about development stuff, and that's really not our purview. And like looking and talking, I think there might be some things we could do now, in the short term. And that there's a lot of data out there. Now that we have the testing system in place with the transfer, with the PFAS, we have a lot more, and there's more data coming in. Do we want to have the possibility of maybe asking Andrew to analyze some of that data in a way that will answer some of our questions? And then the other thing is there anything longer term that we want to do? But I think there's some things we could do in the short term to kind of establish some steps that will protect the water quality. And I have some suggestions, but I'm not sure if I'm ready.
Say that it's more than that. I would say that as a Board of Health, our mission, our responsibility is to protect the health of the citizens of Nantucket. water supply is one piece of that, but there are other pieces of that that are to be considered, I think. There were a couple of things that popped up at me, and as you could see, mostly those are my questions here on the final page in yellow, and I think some of the things that have popped up for me is that the Nantucket Harbor regulations were put into effect in 2015. The Nantucket regulations were put into effect in 2020. There has been no examination of the Hummock Pond area since 2010. There has been no reevaluation of the wellhead area since 1995. So to me, that really, really sort of sticks out and is kind of a red flag in the sense that life has changed a great deal on Nantucket. Population growth has changed a lot on Nantucket. Technology has changed a lot in the world. What we know about harmful substances has changed. We've learned all about the PFAS and the danger that that causes. So that makes us start to think about other substances. And I guess that I think that it's time to really look at these two districts carefully. And what is sort of in my mind is, do we want to look at them as a single thing, or do we want to take them separately? And what you said, Carrie, kind of makes me think that maybe you're thinking of taking them separately, because when you talk about water, you're probably talking more about the wellhead district. Hummock Pond isn't really going to affect the drinking water for the entire island. So those wells, and in one of these questions, I think we've learned that somewhere around 60 to 70% of the population of Nantucket drinks water that comes from the wells in that wellhead district. So that's a big chunk. And so when we go back to my point about that our primary mission is protecting the health and safety of the population of Nantucket, that certainly would impact that.
I guess, but I guess in terms of Hummock Pond, I'm thinking more about the nitrogen into the pond itself. So, and my thought there is that the Hummock Pond regulations already almost mirror the harbor and Nantucket, except for one or two things. And can we essentially have Hummock Pond essentially operate the same as the Nantucket and harbor regulations? And that's more for the nitrogen and the health of the ponds there. But something that we could do to kind of put a little more closer watch on what happens in those areas, in that area. So that's kind of how I saw Hummock Pond.
Well, the easiest thing to do, and we could go home in 15 minutes, is to make them all the same.
That would be.
Make them all the same. Say they're all critical. And the same regulations that apply to the harbor, Nantucket Harbor and Nantucket Harbor apply to all.
And and which I kind of agree with actually. But in terms of, is that something that we can act on now, or are there different parts of that would require more data or more support, or do we have the authority to put the entire island on the Nantucket Harbor plan?
It's not the entire island, though.
Okay.
If you look at the maps, but it isn't. There's large sections that are not.
You want to see a map? I've got.
So I've been thinking about this a lot because where the wellhead protection is mid-island. It's where a lot of people that live here year-round live, and I don't know what the Sconset one is over. But it is concerning because, like, that's it. That's all
Mm.
we poison this. We've got nothing. So I think that it is really important that we protect the wellhead protection districts.
But when I say
Sorry.
whole island, yeah, when I say whole island, I mean the whole island.
Oh, make the whole
The
island?
whole island, not these regions. just
Okay.
The whole island, whole is whole, those are regions and those are subsets, but do we have that? Authority and currently at this point in time, but that seems like a really big. Something that we require a lot more data, a lot more, John Dewe's findings. Where we have some regions already identified of high concern, the Wellfare Protection District, Hummock Pond, obviously the harbor and Nantucket Harbor. Where we have regulations in place and can we strengthen those regulations? Is that an easier task to go forward right now? And, but I would like to get, since we have more data coming in from all the test results, from the real estate transfers and everything, it seems as though there's probably something we should be mining there to help us kind of look at the big picture of the island in terms of where stuff is happening. And that's more of a longer term view. It's just kind of, if we're going to make bigger decisions, we need bigger data.
And yeah,
Well, can we answer that question right now? Do you have enough
I don't think
information?
anybody asked us to look at the entire island.
Yeah.
I think
Yeah.
we're looking at these 4 protection zones, that have been made protection zones for very specific reasons. I'm not saying that at some point we wouldn't need to look further and look at the whole island, but I think to try to go there, is not, I don't think we're ready for that. I'm not sure anything, but I think that the interesting thing that I got from a lot of the stuff that was sent to us is we seem to have what I am calling different strokes for different folks. Depending on, and some of it doesn't really make sense. The harbor is more threatened than Hummock Pond. Well, not really, because Hummock Pond is whatever the heck that word is, however you say it, is eutrophicated. Really, and apparently the reason that I'm getting is that its flushing is very limited, but it doesn't matter what the reason is. The fact is that it is. And I've looked into that. I've asked some questions on that. Is that harmful to people? Again, we're looking at harm. Is it harmful to people, or is it just harmful to fish, fowl, and other kinds of wildlife and stuff like that? And apparently it is harmful to people. It is harmful to people, of course, if it gets into the water supply in that area, but it's also harmful if you're, what do they call it in that famous thing at chapter 91, fishing, fouling, and recreating.
Okay.
If you're out there on the pond, if even if you don't drink the water, if you're near the water. I know when the pond freezes in the winter, kids go skating. I mean, I don't know, but it seems to me that the whole thing of public health is to protect the safety of the citizens, but also to not just think of today, but to do preventive stuff, to think ahead. I think that's what Meredith was referring to a minute ago. If we start to get more and more chemicals and pathogens and bad stuff into our water supply, we could in fact end up like, back how they were in the whaling days where we become a ghost town. So anyway, there's a lot to think about, I realize.
and of our own doing.
So what should we take them as a package? The two Hummock and the wellhead, because I think that the harbor and Nantucket are more or less open and shut cases. if you look at what the only variances that were applied for in Nantucket were variances having to do, what did you say, John? It had to do with, moving a well or changing the boundary of,
Yeah, it's usually always property line setbacks because Mattocket has its own set of setbacks.
so there were no nitrogen, application, no nitrogen loading applications, and absolutely zero in the harbor, in the Nantucket Harbor Protection District. And, you guys gave us, I think, and I have that one back, you guys gave us what was applied for the last, because we were asking for that over the last year. In the Hummock Pond watershed, there were 5 variances granted. And in the wellhead, 9 were granted, for nitrogen loading variances. So that's where people are trying to press the situation, shall we say. And that, those 2 areas are, I assume, why we put in this moratorium into effect until we could think of it. And so that's really what's in front of us today, I think.
And one of the other things that so one is, maybe extending the regulations from Mattocket and Harbor to Wellhead and Hummock. But the other, can we look at possibly amending the innovative alternative bedroom reward?
No, I think that's all part.
Yeah, they don't get there's no.
Right.
That's all part.
Okay, so so that.
They don't get
I
it
think we'll
in
take
those
that off
2
the table
areas.
then, if
Yeah.
we take that
And-
approach. Okay.
When you think we just approved like 30 bedrooms within a mile, all in the wellhead protection zone.
Yeah.
And they're drinking water, at least.
Now, I did, look at, you guys, I'm sure know that, but how much a good IA system prevents. And it ranges from 60. Yeah, it ranges, it removes somewhere between 65 and 90% of the nitrogen going into the ground. It also does do something for phosphorus. And I'm not sure exactly what the statistics are. And it also does something for certain types of pathogens. So the IA systems clearly, although not perfect, make a huge difference. So, I think, Jim, were you gonna bring something up a minute ago and I interrupted you?
No,
Oh, okay.
Well, in terms of the IA systems, we have the general ones that are approved, and that's what we're installing now. And also on provisional, we have those, especially there's 2 systems that are performing so far at a much better rate. They get the nitrogen down to 10 or 11 milligrams per liter versus the 19 that we're getting right now.
Yeah.
Using IA. And so again, like thinking is there a way we can, and well, I'm not sure if we do it, it's through the Land and Water Council or something, but is there a way to be able to get more of those provisionally approved high performing systems installed on the island? Just because, they're producing it potentially twice, going from 19 down to 10. And so, and again, that's more, I think, a little more of a long-term thing, because I'm sure it involves a lot of, not picking favorites and stuff like that. But again, they are performing at a much higher level. And, George, when he talked about them, he said, the data is consistent. You know, it's not like they just started and it's first shot out. You know, they are being installed and the data that is coming up is consistently going down to 10 or 11. So is there something we can do to have more of those installed on the island? And
Madam Chair.
Yes, sir.
Yeah, remembering back a couple months ago, or months, weeks, whatever, to the gentleman from Falmouth who gave us the presentation. That if we were to do that, that it has to be an approved. Now, I may get some of this wrong, and there's some experts in the room that could certainly jump in and correct me if I say anything wrong. But if you go down to 11, it has to be on an approved state list of certain septics.
Right.
And I think it was Mr. Malloy who said that there were only 2 of them that are that. So I'd be curious I think it's a reasonable idea, but I think we might need a little more information, because if there's only 2 of them that are on that list that can be approved, what's the market? Are they even available? I think there's just some more questions that need to be asked. I think when the chair entertains comments, if anybody wants to make them, maybe we can hear from some of the experts on that.
Well, actually, I was gonna ask John whether he can remind us or tell us what are there the systems that are being installed now or have been installed over the last year or so.
Yeah.
What is their filtering capacity on average?
So the 2 systems we mainly deal with on the island for nitrogen reducing, one's called SeptiTech, and actually SeptiTech owns both, and Microfast on SeptiTech, whichever one I forget, but those both get down to a total nitrogen level of 19 milligrams per liter. With that said, right now, as far as
And what would a traditional septic system do? Not
so the total nitrogen effluent on regular conventional systems use about 38 milligrams per liter.
and these get down to 19?
Yeah, so essentially cutting it in half, theoretically, and now trying to improve more and more.
So if what I was reading says that the good systems can do 60 to 90%, then these are sort of medium grade, not the highest level. I agree with Tom that we would not want to insist that people put, the Rolls Royce of IA systems in, but I don't know if we should be having them put in middle of the road systems. Because then we've sort of improved things a little, but we haven't improved things as much as we could be. Does the price go up enormously as you?
I'm
get
sure
the
I'm
better
not familiar with
systems?
it. I'm sure it
Okay.
does. There's a few designers that probably can comment on that. Right now, the standard, well, a few years ago before Title V, I'm talking about 3 years ago before Title V was revised, I think it was 2 years ago. Nitrogen reducing technology was just down to between 19 and 25 milligrams per liter. Then when it was revised, Title V came up with best available nitrogen reducing technology, the Banner systems, which the goal of that is to get down to 10 milligrams per liter total nitrogen, because that's the standard for drinking water. That would be your maximum contaminant level of nitrogen, but it still meets the standard for drinking water quality. So, I don't think the other systems are bad. In fact, SeptiTech.
So we have 19 with SeptiTech. The goal is 10.
The new goal for best reducing nitrogen technology is 10. So that's what on the Cape, in their natural resource areas, their estuary areas where they had documented, where Mass DEP had documented, in short, pollution of the waters there. They require the best available nitrogen reducing technologies on the Cape. So Title V kind of solely focused on Cape Cod at that time when it was revised. And our question was, isn't this a state code? And they said, no, this is for Cape Cod right now, but we're probably next on the list for that, but DEP when it gets revised. And so what that would be really would be, so there's documented total maximum daily loads by Mass DEP for Nantucket Harbor and Nantucket Harbor. So those would then be officially classified by Mass DEP as natural resource areas and would require a bannered system to be installed. So that's kind of the direction of the state. The direction the state's going in, so.
My other question, as we can see from these maps, there is zone A and zone B. And if you guys read my question and John's answer, should we tackle them? Should they be one thing, or could we separate them? John's answer, I think, was simplified, making it very simple. The closer you get, the more risky it is, and so that the zone A would be where you would probably want to focus. And when I asked you whether you thought they could be separated or if that was a stupid and foolhardy thing to do, you said yes, they probably could be separated in terms of, making different rules for them if we wanted to think in terms of that.
Well, they are delineated on the maps as two different zones, so
A couple of them, I think the wellhead, there's very little difference between the two. A
There's the
and
upper and
B.
lower.
And I think they
Yeah.
call it upper and lower, but it's not much, there's not much difference. The way there's quite a lot of differences in the Hummel Pond. B goes way out.
yeah,
A is sort of immediately around the
yeah,
pond.
yeah.
And so is the harbor. The B is a lot
Yes,
wider.
and I believe that rule that we've just been quoting, it applies to in the harbor, both A and B.
Yes,
Correct?
yeah, yeah,
And in Nantucket, it applies to both?
correct,
All
yeah.
right, good. Um. I guess I don't see any reason to separate these districts. For me, it's all one problem, and it should be all one solution. And the solution that we have for Nantucket Harbor and Nantucket Harbor District should be applied to the other two. That's how I feel. I don't know how everybody else.
That's where, that's
Feels
where I am. In terms of being able to do something now, yes.
I just have a question. I agree. In the law as it stands now, if you have to upgrade to an AI when your system fails or when the house is sold
New construction.
and new construction, is
Yeah.
that what it is?
Full term,
That's in Nantucket Harbor Watershed and Nantucket Harbor Watershed.
So we would be applying that to the wellhead protection and Hummock Pond, that if the house sells, if the system fails, or
They pull a permit
or
for
they-
construction, yeah.
or there's new construction.
Right,
Right.
yeah.
And we'd also would remove the extra bedroom credit.
No extra bedroom.
That's what we have for Nantucket.
Mhm.
That's right.
So essentially, we're just taking that and just moving that, and just saying those rules from those two regions will apply to the other two regions.
Right. Just because I don't see that the threat is it's a different threat, but I don't think it's a lesser threat for Hummock and the wellhead than it is for the Nantucket Harbor District and the Mattocket District.
You know, again, we have a single source aquifer. I mean, we can, you know, we try sorting it all out, but the bottom line is it's one big pot of water. And,
Right.
you know, if our goal is to protect public health, and one of those steps is to maintain the quality of our single source aquifer, you know, that's what I'm saying. There might be some longer term things we might want to start working toward, but there might be short term things such as, you know, doing the zone, you know, making them all the same, to at least kind of, you know, at least a start. And also clarification of, if you're in the region, there's one set of rules.
Right.
If you're in any of those zones.
If it's the same problem, it's the same solution.
It might be caused by a different thing, but it's the same problem
Right.
at the
So
end of
it's
the
the same
day.
solution.
Yeah. Um,
Uh, So, um, it sounds like
Do you need a motion?
well, do we want to maybe have?
I think we have,
I'd kind of like to
you
hear.
guys, I know you guys are here. You guys are here to tell us why we're wrong.
Want to hear from you guys.
Tell us why we're wrong with that. Yes,
May I go real quick? I don't, on process, I'm kind of generally fine with where we're going.
yeah,
At the moment, depending on public input, et cetera.
right,
But, I think what we should do is, and I'll leave this up to the chair, of course, would be, if we're gonna decide something, I don't think we should do it today. I think it should be in a packet, and there should be a week or two for public input, for letters, et cetera, for residents, the constituents, et cetera, to weigh in on this. I just personally, I would abstain from or vote no on this today, just because I want to hear more public input. I'm used to something with SB Select Board being on the agenda and voting on that. But I'll, you know, the committee can do the will of the majority on that. But that's what I would like to see, is a week or two for the public to digest any such potential policy change.
and then what?
We come back and vote and take it.
But what would the public's input do?
Well, I think there may be, I'm totally just gonna do this off the top of my head, but I think there could be, right? Could be unintended consequences. And again, this is my fourth Board of Health meeting, so this is new to me. But there are availability of systems. There's only so many installers who can do it. There is affordable and attainable housing world. I know most of it's sewer, but there are folks who are caught up in the moratorium, and I mean that in a judgment way, but caught up in that. I think there may be some things that come to light after a week or two of public input. Maybe not. But I err on the side of letting the public digest. I'm not saying you're not, like we're not, but letting the public digest it and come back and then deliberating on with a more fulsome set of comments from the public.
I think, and because I've been thinking about this, one, we've been doing, respectfully.
Yeah.
I think we've been talking about this since June, right?
We've been talking about this
Okay.
for as long as I've been on this
I mean, the
board.
moratorium started in what, June or July? June?
Yes,
And so it's been out, I mean, it was in the newspaper, it was in the current. And I'm not saying that we have to make this decision today. But I think it has been out there that this is being discussed.
Being discussed, but no specific action.
Yeah, right. And I think if you look at all of the affordable, attainable housing that is out there right now, the majority of it, I would say. Oh, probably almost all of it is in the wellhead protection zone and on town sewer and town water.
Sure.
And I also think if we don't have clean water, we won't need attainable or affordable housing because no one's gonna want to live here. So that will be a moot point because nobody can live here. There's no water. I don't know if you've lived without water, but I couldn't use my water when it had PFAS in it. And to not be able to give your kid a bath because you don't know how that water is gonna affect them. And to not be able to make coffee or boil water to make pasta or any, like, think about if you, every time you did that, you had to take out a jug of water. To do that, it's not fun and it's not easy, and I think that is really like something that we have to consider because we know that there's already PFAS in our aquifer. It's in there. At what level? We don't know, but we know it's in there and
Well, that shows
It's
us
that-
that things can get in.
we know things are
That's the
getting in.
example
And
of-
so if we do nothing and just keep kicking the can down, we won't have to worry about affordable housing because no one will want to live here.
Right, but just for the record, that's not what I'm suggesting.
Yeah.
I may be.
No,
He's saying
I'm not saying that we have
He's
to
saying
make a
what-
decision
that's it.
today, but I
He's
think that
saying
we
what-
do have to make a decision.
He's saying 1 week.
Yes,
to-
yeah,
to
yeah,
let
I'm
it
not,
be.
I was not trying to say that,
Yeah,
I
Understood.
I don't think we have to make the decision today. I think that we do need to make. a
we can make
decision.
I think we can
And-
probably make an indication of what way we are.
Yeah.
What direction we're headed. But yeah, it doesn't have to be finalized.
Yeah.
Mhm.
That's fine.
Go.
Thank you. For the record, Paul Santos with Nantucket Surveyors. And more so, just a point, I think sitting back there, we understand where the board is tending to go with this. But specific to this meeting is posted as a follow-up discussion on the septic system nitrogen loading credits in nitrogen and pathogenic sensitive areas, which specifically relates to the moratorium. So this is advertised to deal with the moratorium.
Mhm.
The more global discussion that you're having with regard to the two districts that you want to mimic, the transfer of property, IA upgrade, the new construction and so forth, appears to me to be more of that's a regulation change. And correct me if I'm wrong, but if you're proposing a regulation change, that has to be public notice and then public hearings. So am I wrong on that, or is that correct?
You're absolutely correct.
Okay,
Right, but this is a public hearing.
but has not been, the changes that you're talking about have not been published,
Hasn't been advertised.
hasn't been advertised.
Right, because we haven't identified them yet.
Oh, no,
We're
that's
identifying them
correct.
now. what
So
they are.
you're voting today to make a recommendation, but the recommendation is going to be what you're talking about today. So today's vote isn't going to be
Final,
final,
right,
but it's going to be a recommendation to proceed.
that's right,
to the
because there are
next
lots of steps, I'm sure, that have to be taken before we can make a
Yeah.
regulation change.
Now, we still have the issue of the moratorium. And
But the moratorium did, as I understand it, only cover those two districts.
correct. So as of today, if the moratorium is going to be extended, that's one thing. If it's not going to be extended, then there's now a gray area of time when are you going to entertain applications for the bedroom credit? So there's then that issue that has to be dealt with.
Yeah.
And to the issue with the bedroom credit, and George specifically made 2 points, I think, when he made his presentation. Number one was that it's not the board's function to control growth, which I think you all know, and that's not what you're trying to do.
We've
You're
done
not,
that many times.
I mean, you understand you're not trying to control growth. And he spoke specifically, and there's been discussion today about the 10 milligrams per liter systems that are out there, the two systems that are now in, I believe, either the piloting or the stage at DEP. Now, quite honestly, Don Bracken, who is here, has actually designed one of these systems, and it's being installed, I believe, in Nantucket. That's one of those systems that's being installed. Already installed. And the regulations that George was talking about specifically was the Falmouth regulation. I have the Falmouth regulation here. It was set up for new construction in which they would require that the best available nitrogen technology would be applied to all new construction within the town of Falmouth. And that specifically is the 10 milligram per liter systems. This is now in the public hearing process. I think they just had the first public hearing on this last week. It was noticed and they're now going through, that process. I'm gonna leave this with John for the board for everyone to see. This is the Falmouth regulation that's now being proposed. What my thought was that in the interim, on the bedroom credit issues, whether it be Hummock Pond or the Wellhead Protection District, whether this board could vote today to say, listen, we will entertain the bedroom credits. But if we're going to entertain those, it has to be to the 10 milligram per liter standard. Again, I don't know if that can be done without a public hearing, but that's just a thought moving forward. I think your intention is to say no bedroom credit moving forward, but my thought was in the interim, if the moratorium there is a time frame it's lifted, you individually review these and then specifically say, listen, if that's the case, we are going to go to the 10 milligram per liter requirement. So just a couple things to bring up. I'll leave this with John, but that's the Falmouth reg that is now being proposed.
Yeah.
They're proposing the 10 milligram per liter for all systems for new construction, townwide. And Don does a lot more work. I don't do any work off island, but Don does the Cape and Islands, and Don deals with his office is now dealing with all the public hearings and so forth for that particular case. So again, issue today is the moratorium. I think we know where we're going, where you're now going to advertise those other two items. And I'm happy to take the time to listen to me. Thank you.
Thank you.
First, I'll piggyback on what Paul said. Yeah, our office is really involved with Falmouth and Bourne. And tonight, Bourne is actually having a Board of Health meeting to do the same thing Falmouth is doing. They're basically following what they're doing for the best available nitrogen reduction technology. Now, there is a lot more.
Stop for a sec. So that means they are requiring that in any new construction or failed system, a 10 milligram per liter system has to be installed.
They are requiring that in the nitrogen sensitive areas
Right.
that John was talking about, the new ones that were established by Title V 3 years ago, which originally was going to be statewide and would have included Nantucket, but they decided just to focus on the Cape. And the other thing with the Cape is that they allowed each town within each of these designated areas to develop their own plan in 5 years to be able to address, reducing the nitrogen in those areas, putting the, burden on the town to bring in sewer and come up with all these other things. Well, now 3 years has gone by and a lot of the towns right now have not come up with adequate plans to lower it. So that's why like Falmouth and Bourne, now they're saying, okay, now we have to hit the individual homeowners, right? And so they're really first focused on any sort of like, maybe they got it from Nantucket, but they're focused on people that are coming in that need a building permit, additions, anything, you have to be adding a new bedroom as long as you're triggering a building permit. This is how they're going to try to get people one at a time. But they're also talking about having something laid out over the years that people will be required after a certain amount of time to upgrade. But I think the important thing is that like any Board of Health regulation, like I've always talked about this on the Nantucket regulations, and it sounds like these aren't policies, these are regulations you're gonna have to write that are gonna be spelled out. Any regulation that's beyond Title V, the state says the town is allowed to do that, but they have to have scientific backing to be able to do it. Now, obviously, like the harbor watershed is clear. You studied that, it needed, you needed the extra treatment, and so the regulations were tailored to that. Same with Nantucket, same with Hummock Pond. But now when you get to the zone 2 areas, the water recharge areas, that's gonna get tricky. I don't care what the board does, we just, we'll follow the rules, whatever they are down the road, but I don't see how the board is really gonna be able to come up with something that's gonna be fair and scientifically backed. Now, we all know there are plenty of chemicals in there, but we're only dealing with Title V with nitrogen to this point. They haven't, the state isn't addressing anything else. They mentioned phosphorus, but there's no phosphorus reducing technologies really out there, that can help with that. So I just think it's something, again, you're gonna talk about it more in the future, but, you even say you get all this well data right now. You have all this well data in the existing zone 2s, and you have all the nitrogen loading, all the nitrogen data in these zones too, so you can, maybe there are zone two areas that have very little nitrogen loading, right? And others that have very high, so maybe those are the areas that you need to introduce these systems to. And, originally, I'm a little confused, and I was confused originally because we're talking about, okay, let's do the same thing in both district, in the Hummock Pond and the zone two that we're doing. Everyone has to, there's no increase, but even in Nantucket and even in the harbor watershed, it's still 1 bedroom per 10,000 square feet. Now, that was changed to require IAs at the time of sale of new construction. So is that something that you're gonna do in a zone two? How are you gonna force people to do IAs and yet not get any credit for those IAs? I mean, is that what I'm understanding? So you would still require somebody on a 40,000 square foot lot, even if they only have a 4 bedroom, that they would have to put an IA, because that's what's being done now in Nantucket and Harbor Watershed. Do I have that right? Is that,
Yeah.
okay? All right, well, I'd be interested, down the road, how, what the scientific backing of that is gonna be. And it could be the other chemicals that aren't being addressed, and that's why you do it, but, I just think, when people realize, about the changes, they're gonna wanna know that, there's backing behind it to justify it.
And when we ingest PFAS, we also exclude it. So
Yeah.
it's going to be going into our ground, which in some places, due to variances that we've approved, there's not the same number of feet between the groundwater and the septics, or the number of feet that they're supposed to be because of the situation on the lot, but they don't get anything in Nantucket or the harbor, right?
As far as people.
No, like there's no bedroom credit in the Nantucket
No.
harbor or the Nantucket harbor. So it would just make,
The word that was
Well,
used
had
there was
protection.
interesting. I read a thing. It was put into effect so there could be no backsliding. That was the word that was that I read in some of the information that John sent to us. That was the reason for the harbor thing that was amended more recently. And I think one of the things that I'm very concerned about is that these two districts have not been looked at for years and years and years. So our knowledge of environmental pollutants and problems has come a very long way, I'm sure, since 1995, when the wellhead area was first looked at, last looked at, and 2010, that Hummock Pond was looked at. So it is almost incumbent upon us to be re-examining it at this time, I think. Regardless of what the decision is that we made. But anyway, but I think yeah, do you would you like to say any more, John?
The last thing I would say is, yeah, that sounds good. Look at what the nitrogen loading is today in those zone twos. And you can enact, more restrictive nitrogen loading by limiting the number of bedrooms. But is that really the problem? Problem may be something, maybe the other things that you're talking about, maybe that's where the focus should be,
Are you saying that you want to split zone one and zone two?
No, I'm not saying
Because you
that
keep
at all.
referring to zone two.
Well, when I say zone two, I just mean
The wellhead.
the wellhead protection district.
Oh,
That's all.
okay,
That's all.
because
I'm
some
sorry.
communities have zone
Yeah,
one
yeah.
and zone two.
Yeah,
Yeah.
yeah.
What
Okay.
we call locally,
Yeah.
our regulation is called the wellhead
Yeah.
protection zone, but it's really zone two is what.
Yeah, I've never heard it, I've never thought of it that
Yeah,
way, so that's way, okay.
Yeah.
All right, well, thank you for.
Yeah, you're welcome.
Heather had her
I
hand
just
up.
had a question I
Sure.
wanted to bring to the table, maybe John can answer better, but from my understanding, this is Heather Nardoni.
Yeah.
Just for the record, IA systems don't reduce, there's no science to back that it reduces PFAS.
No. I think she was just
No,
using
I
that
was
as an
just
example.
saying there's
Okay,
more.
I just wanted to clarify that because that can seem confusing online, like it's to reduce nitrogen.
Oh, yes,
Yeah,
I'm
okay.
just saying, like, not having the more bed, like all of, like we excrete that into there and less stuff being put into the ground.
My concern with the PFAS is just that in finding it in some of these wells, it is a good example to us that stuff gets in there.
Yeah, it's happening, yeah.
And if that can get in, a lot of other things can get in, including, nitrogen and
Well,
other stuff,
it's
so.
those, the emerging things we don't know about.
And we didn't know that in 1995, and we probably didn't know that in 2010. So I think, re-examining it today is a very important.
And I would bet that there is a lot more pressure put on the wellhead protection zone now compared to 30 years ago. There's a lot more buildings there, so there's a lot more toilets there.
Now, a high percentage of that district is on town sewer. So it's not as pervasive as, we might worry that it could be. Because that looks like a really big district if you look at it with a lot of people there. I think, what is it, 70 or 80% are on sewer in that district?
That's about what I would guess.
Yeah.
That's not, that's more of a
Yeah.
guess and not an approximation,
Yeah.
but just eyeing it and where the zones or the areas I know, I would say 70-80%.
So to go back to you, Tom, your idea would be to have a sort of a general idea of what we want to do, and how would you want to, how do you propose that we would sort of notify?
So if I were gonna design it, right,
Yeah.
we come up with a policy or regulation change, whatever is on the table for the moratorium, which we're looking at. Rewrite this one-page agenda with a note that says, follow-up discussion and deliberation on proposed regulation policy change with how many ever pages or whatever that change is. Put it out there for a week or two, let the public send in letters, come to our next meeting, and then come in and deliberate, have it posted, obviously with accordance with the town clerk and 48 hours at least and all that stuff. I mean, more than 48 hours, but at least, and then come back and deliberate and take a final vote, or whether there needs to be a public hearing in addition, or schedule a public hearing, or whatever the regs call for.
It's a regulatory change.
So the regulation that we propose would need to be completely written out before that time. Is that what you?
No, I don't know.
I mean, I'm assuming that it will, right?
Yeah, so
Yeah,
process locally in order to change a regulation is you have to notice it in the paper at least 3 weeks. So that's once every week before the meeting, and you would have a draft ready to discuss, or you could write something to discuss for the meeting and read it and make changes, amend it. Always, of course, recommended to go to town council for review to check language and vote on it, and however you decide to go, and that's that. But yes, it does require, you'd want to write something first, then hold a public hearing. And then, which, gives the public notice and allows them to speak and add comments towards the regulation, and then the board deliberate and make the decision. So, that's the process.
which means that I think what that means, is, that tonight we have to vote to do something about the moratorium.
Why?
Because if we have to go through this process,
We can just wait a week and do what he says.
I don't think we can get it done in a week. This is a big project.
Not sure.
Yes,
Jericho.
In one case, this is slightly simpler because the regulations already exist for two of the areas. And so much of the regulation is already written and reviewed, it just needs to be reviewed to see if it can be extended to other areas.
Okay, so we wouldn't have to sort of totally
We'd
start
be
from
starting from
scratch.
scratch.
Yeah,
It would still need to be evaluated for legal purposes, but it's not the same as writing a completely new set of regulations from scratch.
right.
But there is still the gap between the moratorium expiration and then whenever this process starts before we enact it.
Right, and plus, what we know happens in a regular board meeting, Board of Health meeting, which is gonna be next week. Is we're packed to the gills with all kinds of other situations that we have to think about and deal with. And so to have any kind of substantive discussion next week, I think is not realistic.
Could we extend the moratorium till our October meeting, and in the meantime, put this together and there's enough time to notice it in the paper that we'll have the public hearing in October?
Well, yeah, I think the findings exist, the rationale for the Hummock Pond here. I don't think it. So the question seems to be the wellhead protection district largely because of town sewer. So there's a portion, 20 to 30% that aren't.
Largely because, say that, I clarify what you meant by that. Why does it make it controversial because of town sewer?
Well, is that something that is, that waste is accreted into the sewer system and out to the plant. And is that something that, the question is, does that impact our decision making or not? And if it, is it necessary to separate? Simpler question, do we have the finding, do we have data to say that we justify to do something in the wellhead protection district? Is there the basis, do we have the right kind of data, right kind of information to say that, single source aquifer, we're seeing this and think it impacts? I think that was I think where Paul was kind of going down, we're going to this like that, the Hummock Pond is kind of, yeah, we know. The wellhead protection district, do we have the data to go forward at the same rate of speed as we can with Hummock Pond? Personally, I think so, but I'm not looking at data. I'm looking at a single source aquifer, and everything we do everywhere impacts everything. I don't, so, if we were to say that the wellhead protection district we feel is involved, and we have, like the chair said, the regulations are written. We could essentially, I think, pull together so that for next week, we could verify that, yes, we want to go ahead and start that 30-day regulation review process for public notification, so that we'd be able to act at the October meeting. And, do a final vote on it. So
Madam Chair, if I may, so you'd have to get that into the packet really quickly. And so that starts happening tomorrow, the next day.
Mhm.
So depending on which you all is planning on making this modification, that's a extreme time frame.
it's tight.
I am essentially out of, what is the word, pocket, because we're moving for probably the next week or 10 days. So I would love to be involved in writing this and everything, and helping to get it the way it should be, but I'm not really very available for a week or so. And that, now we're, I would propose 60 days. I would go to November. Okay,
Madam Chair,
yes,
excuse me, I have to go slightly.
I know
So,
you do.
okay,
Yep.
see you next
Okay.
week.
So what information do we need to reliably and comfortably go forward with saying the wellhead protection district and the Hummock Pond district will have the same rules as the Nantucket and Nantucket Harbor? The Nantucket Harbor and Nantucket Harbor. Again, it has to be based on, our
Right.
rationale has to be based on findings.
And I would just say that, we provided pretty much all the data that we have. And I think contained within the regulations and the studies that have been done,
Yeah.
a lot there. So really someone to get into what's already there and make that determination as to what's going to be. what you feel you can move forward with. So that's, like I said, we don't have anything else.
Yeah, so, I mean, guess, you know, I mean, in looking at all that stuff, I mean, like, I'm comfortable with. I think that there is a reason to sit there and say we need to protect the entire water supply. And we can work in these zones in these regions now. Bigger picture stuff is down the road.
So the other question is, do we wanna, on this, it just says, do we wanna do what, John was talking about, that they're doing in Falmouth and Bourne? Do we wanna say going forward? We're gonna do the 10 milligrams or whatever it is per liter.
Yeah.
But that's a sort of a,
And that's kind of jumping into a newer area. And I think we need more. Yeah, I would.
well.
Do I agree with
It
it?
is,
I'm not
honestly, if
sure.
we're gonna protect it, we gotta protect it to the
Yeah.
best of the ability that there is out there.
Well, if we use 10, there's.
And
only
if
one
Falmouth is doing it, I mean, it's not like we would be going out on a weird limb that nobody else has considered.
Falmouth and Bourne.
And
Yeah.
Bourne's jumping out to Falmouth. So,
Yeah,
Do.
I mean, why go halfway if we're gonna do it, is kind of what I'm thinking,
Yeah,
right?
right.
But that's, that doesn't necessarily affect the timeline, it would just be, so I think.
yeah.
Do
Well, I
we,
guess I'm-
do we feel okay with 60 days to just get this pulled together the way we really want it? It sounds like we have to send it to town council.
Well, another way to look at it, again, though I agree with you, might be, do we do the first step is just existing regulations that exist will be applied to those two. And the next step will be to move it down to 10.
Oh, yeah,
Or
all
11,
right.
because right now at
Mm.
10, there's only one system. Now, if you have 11, there's two systems. There's one that comes at 11, one comes at 10. So, I mean, the thing is, and that's it. Right now, from what's on the provisional list, those are the only two out there. And do we have what's the capacity on the island to do, I mean, there might be just more stuff that we need to do in order to push that one, where we can do something pretty quickly to, kind of A, get the message out that we are doing this. B, we're going to protect what we can immediately. And then we're going to now look at what we can start doing a little longer term, which might be to drop it to 10. And then there might be other things even longer in terms of what about the rest of the island? I guess I want to do something soon.
I think we should take our time. We know what we want to do. We have to wait to listen to what he wants to do. We know what we're gonna do. If we listen to what they're gonna do, we know what we wanna do. Let's just wait and do it the way we wanna do it. And just do it once. And do it right. And just do it once. Right?
Yeah. Well, we could write it the best available system or something like that.
Right,
And not have it,
right. Not have to go back and do something.
not say, but if we say that, then people will try to game that system a little bit. So maybe we do have to have but anyway, I don't think that's for right this second. I think what we need to do is decide how long we need to extend the moratorium that is currently in effect to get this done the way it should be done and sounding how we want it to sound, and also in a way that we know it will pass and not get shot down somehow by somebody.
Can I ask a question of our local experts here? Is there a reason that you guys are using SepiFast and MicroFast? Because those are the only ones we see, except for the one in Nantucket, which I feel like we had a big discussion about. Is there a reason you guys are using those and not using one of these ones that are 10 or 11?
Well, these are newer, number one.
Yeah.
So the standard has always been the other one.
It's pretty simple, really. The Septic Tech came on board because they had an island presence, and had people on island that installed and maintained it, so we use Septic Tech. And the MicroFast system is a gravity system. So depends on the situation of each project. If we have a project where it's a gravity type system, we went with the microfast because it's only one tank, not two tanks, less work, less expensive. It was a gravity system. If the power went out, it still functioned until electricity came back on. It works with an air blow that adds air to the system. And the septic tank has pumps in it. It's a little more expensive. It has two tanks. So, there's the pumping factor and there's the space factor. In a lot of cases, we don't have space for both things. So that was the primary reason I think everyone used them, is because both those companies had a presence on island to be able to maintain it. Now, the new system we put in, Nitrex, if you recall, that's been in for about a year, has an over 90% reduction right now.
Mhm.
in nitrogen. It's doing unbelievable, but we haven't been through the full summer, so we haven't been submitted everything, as part of the approval. Now, that system is twice as expensive as either the septic tech or the microfast. So, obviously, there's a cost there, but it has proven to perform a lot better. That's why Falmouth and Bourne are leaning toward that system as well. Even though the septic tech is fine, it's had great numbers and everything else, but it depends on how far you want, to get that number down. So.
Yeah, I mean, I think that's gonna be an interesting
Yeah.
question. It seems to me if you need to protect your water supply, or you need to protect your harbor, or prevent whatever that word is, eutrophication, you better have the best that is available. Otherwise, you've sort of gone halfway, and what's the purpose of that? Anyway, but that's another thing. Do you think we're ready to make a motion to extend the current moratorium on, what is it actually called, on septic system nitrogen loading credits?
How long do we have to extend it?
I'd say 60 days. I think that gives us the leeway to be
Alright.
able to,
I'll
that
make,
takes us to November.
I'll make that one.
You'll make that motion?
Yeah.
I'll second it.
Okay. All in favor?
Aye.
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 All right. So I think we have moved to extend the moratorium, and in that intervening 60 days, we're going to have to come up with a new regulation. Or an adaptation of the current regulation is actually what we have to do.
That might be the easiest first step, is extend what we got, and then down
And
the
we
road,
have to,
then-
we have to go through the
30 days.
research materials that we have to come up with a reason that everybody can buy.
But
We can't just say we feel like it.
Yeah.
Yeah.
And again, there is a lot of information in the various,
Yes.
each of the,
Yes.
each of the districts that we
also,
received.
it's gonna be reasonable work.
Now, the question is, and this is where I'm a little naive, in terms of this, can we work together on it?
We have to.
Did you mean around open meeting law restrictions?
Yes.
So
Can the board work together to write it the way we want to? Can the 5 of us, 4 of us, whatever, work together?
I don't believe so. I think it
No.
would have to be written by a single person and then distributed to the board members prior to a meeting. So,
Yeah.
Can we work with,
It's
can
just-
one of us work with you? Not,
Yeah.
you guys to, so that you could say, hey, don't say it that way, say it that way?
As long as we're not the lead on it, as long as one of you all is the lead,
Okay,
we're happy to contribute any expertise that we have around the writing.
I think we all know what we need to do.
well, but it has to be written in a really, sort of good way. It can't just be sloppy and stuff, and so that's what and, so then would we send it to town? Would we send it to the council, the attorney, before we presented it?
yeah, I would recommend doing that.
Okay.
Absolutely.
Okay,
You know, and again, the most efficient might be to just extend what we got, because it's already been, is past muster. You know, what happened in Nantucket Harbor, Nantucket is an existing, we've been using it, so. If we use that as a first step, we can probably that should be pretty simple and quicker.
well, that's what Jericho was saying. We've
Yeah.
already got the regulation.
Yeah,
Now what we need is the why.
yeah, and I think for Hammock Pond, I think we're pretty solid. And I think, honestly, I think we're solid for the wellhead, but we need to articulate that in a clear, be able to, clearly articulate why.
Mhm.
And it's pretty simple, if they have the same problem, they have to have the same solution, right? I mean, you don't have to dig into each one.
Yes, the problem isn't exactly the same, but,
Well,
because one is water quality, water safety, and the other is, the preservation of the,
Drink.
but, okay, so. Who's gonna do this?
You know, not gladly work with, I mean, for John or whoever, to kind of come up with something that would.
Okay. He's you're willing to do it, Karen?
Yeah.
All right.
Thank you.
Can we work separately with you? In other words, could Carrie come in on Wednesday and I come in on Thursday?
Serial.
We can talk,
Okay.
we can
All right.
talk ideas with staff,
Well,
but then as soon as you start circling it around.
Threshold for deliberation on any item that would come up on an agenda or could be on an agenda is two.
Yes, that's what I thought.
Theoretically have two people working on it, but serial communication would be having one person and then next person and then the next
Okay.
person, next person.
All right.
Well, is serial allowed? I
Serial
thought
is
serial is
not.
not allowed.
It's not allowed, no.
Yeah.
Yeah.
Okay, so.
Okay.
Sorry.
So you could that. You could have two
Technically, you
people
could have
working.
two people.
Okay, great. Good. Okay, now I have a completely different question, but I've been getting this question a lot. Are we having an immunization clinic this fall?
Yes,
Do we know when that is?
tentatively scheduled now for October the 25th.
October
Yeah,
25th?
there's gonna be a couple of earlier clinics, one put on by the hospital and one at the senior center or senior expo. That will involve just flu. The federal government has been delayed in providing guidance around COVID, the vaccine. And so we're waiting for the state to come up with their recommendations before we can actually even schedule it. So, but right now, that's the tentative date.
October 25th.
Yes, ma'am.
Okay. Thank
And
you.
is that COVID or COVID and flu?
It'll be both then.
Okay.
It provided.
Yeah.
It's the guidance, yeah.
You will give us a full update on next week, right?
Yeah, I just had somebody.
Yeah.
Didn't know if they should try to go somewhere else, and I said, no, I'll ask. Anyway, okay. Thank you. Whew.
So once this, I just wanna make sure I understand.
60 days
Once,
is,
but once you guys have done this, then we can put it in the newspaper and
So.
Jericho, yes, and you tell us, after we do this, what do we do next?
And so to my understanding, if you're looking to, this is on the work on the regulation.
Yes.
So
Do we finish that and we
No.
get it, we get it the way we want it to sound.
so John is probably more familiar about the regulatory side of the posting and the noticing, but my understanding would be that you would get the regulation and as close to a completing form as you would like. Then it would be sent for legal review through town council. As long as it passes the review through that process, then I believe it goes through the posting and public noticing period, and then is voted on by this body. But regulatory, I'm still relatively new to regulatory boards, so I'm not exactly sure about that.
Yeah.
I think what Paul said was up to 30, with that 30-day, I mean, that's what I have in my head too. So 60 days would allow us to develop it, get town council review, and then go into the 30-day public review period that we then can act on after that. And that would be the November meeting then.
So we need to have it done and reviewed by town council in 30 days from now. We need a 30-day
We,
period before the November.
within the next 30 days, we have to have that ready to go, so we can do the formal posting and allow 30
And it
day
has to be
period.
posted for 30 days.
I think for regulatory changes, yeah.
It's three
Three weeks.
consecutive weeks in the newspaper
Okay.
before
Yeah.
the meeting. So
Okay.
what I'm looking
Yeah,
at
when's
is,
the meeting?
so November 20th is the scheduled November Board of Health meeting.
Okay,
So the advertising would need to start October 30th, November 6th, and November 13th. Those would be 3 weeks prior to the meeting. I believe that's correct.
Can I make an
Unless it comes out on
amendment to our extension? Because
Yes.
60 days doesn't bring us to our November 20th meeting.
60 days.
We can extend it to November 20th.
What's today? Oh, it's only been
because-
10.
Yeah.
Yeah, but from the moratorium. From the
Right.
moratorium's not running out until September 18th, right?
No, we had.
Okay, so that will bring us to our.
Yeah, that's right, because we had to go as if this meeting wasn't existing, yeah.
This is a special meeting. The
Yeah.
moratorium has started on June 18th.
Yeah, when the
And so
regular
90 days is probably not quite, but anyway, 3 months is September 18th is what I think.
Yes,
That's how I interpret. You look worried, John.
I'm just looking at the calendar here. I think November's definitely doable by the board,
Oh, yeah.
I can't speak,
Well,
but I think we would have to the board would have to have it completed by
October,
the week of October 20th through 24th. So
well, wait, it's gotta go to the attorney.
Right, so then
Right.
it should become, we should have it back from the attorney by the 24th in order to post it on the 30th. You gotta get it in the paper for the 30th, for the first week.
right, yeah, because I think the paper, maybe we can contact them Monday, the 27th to advertise October 30th. I
Yeah,
think that's generally
Is
okay.
Monday okay for Thursday?
yeah, that's how we've done it with the grant application.
Okay.
Notification, so that should.
So we would want to have it back, we would want to have opinion back from town council, probably look for the 24th, just in case he says there's something we gotta tweak. So if we could have it back by the 22nd, that gives us 2 days, just 2 days plus the weekend to, if there's anything that requires tweaking, notify the Inky on the 27th, so posting on the 30th first week, and then just the following 2 weeks.
So once Carrie and I, as his assistant, get this thing written, which honestly, once we start to work on it, I think we can do.
It's gonna go, I mean, if we're
We
gonna
can-
use.
Are we allowed to send it to these two guys?
We'll send it you can send it to us and we'll send it before.
Yeah.
Yeah,
Okay,
so
Yeah, but
I
we
think.
gotta avoid the serial thing, it's really.
Personally, I think if we can send, or if you can have it written and sent to town council by October 15th or so, that should give them a little bit of time to review it, because they'll,
And actually, we meet on the 16th, so that would be a time that everyone can hear about it.
yeah.
what did you say, John? What's the date? 15?
So I think, to allow for time for everyone, if it's drafted by October 15th and sent to town council the 15th or 16th, that would give town council, a little over a week to review it. Hopefully that's enough for them. I can't speak for them, but
It's gonna hinge on whether or not there's a legal rationale for extending the existing regulations to zone 2, basically. I think as it is, the review should be pretty, I would guess it's pretty straightforward applying at the Hummock Pond,
so I guess we could maybe contact town council and.
How much time do
Be
you
ready.
how much time they need to, I mean,
Yeah.
if he says a week, then we're fine, if he says 10 days, then we just take their advice as to how much time they're gonna want. Who contact them?
that would have to be the department.
Yeah.
Yeah.
Requests.
You would do that, but
Okay.
yeah, you certainly make that, you'd make that request.
Okay, Carrie. Here. I think it's, I mean, once you sort of sit down, put your mind to it, I think that's.
Yeah, no, you know, again, I think it's really gonna come down to, are we gonna just kind of try to move forward what we got? And, you know, at a later date, kind of push down to 10, 11, or try to push it all into one.
Well, the only problem is that these systems, what'd you tell me, they last for 25 years or something?
Yeah, that's a good rule of thumb, you know, it all.
So if you get a system in
Definitely.
that's mediocre, you've got the darn system for 25 years.
Well, the microfast, I mean, those are the best. They're the best now that are in the general list that are, you know, solid.
And they only take you to 19?
Those taking the 19, and then the other ones, the 10, 11s are in the provisional list, which means they're in queue to be approved, but they've got to, you know, produce enough data to show that their results are consistent. So, they're on that
Oh,
provision.
so they're provision, they're not really. So why would Falmouth and Bourne be insisting on them?
Because it's the best technology that seems to be available.
So I don't, if I make
I don't know
comment,
if
I don't know if
they're-
it's, if they're strictly saying the 10 milligrams per liter, or if they're just saying, I think they're saying best available nitrogen reducing technology. So at the moment, or at this time, Septi-Tech and Advantex
Yeah.
are the two systems approved for general
Yeah.
use. So they technically are only certified to 19 milligrams per liter right now. However, the data for both those systems has been below 19. So that's
Okay.
why they're
Somewhat open, you use open that, yeah, the best
qualifying
available.
them as that. And eventually, as these other systems develop, you know, it's gonna be a race, basically, I think, with these companies to really work to try and improve and get, you know, do the best that they can and, to
Well,
all
best
get system-
available,
get-
best
so-
available might be good language.
So, yeah, I mean, that's the language in Title V. So,
So that
It
doesn't
leaves it a
really
little
give you
bit
the
more.
option to go for the cheapest. At best available is,
at the time of permitting, yeah, that's how they basically do it. I'd have to read through this, but I'm guessing,
okay.
I'm gonna assume that's exactly what they're going to say based on everything I know from Title V and the way that the state's going. So, oh, actually,
Okay.
They specify specific nitrogen levels?
Right.
Sorry, I was wondering, I thought from the discussion, that George had, they were asking for specific nitrogen levels.
Yeah, that's a 19, 10, but
Below
there's. You know, the other thing you always want to be careful of, though, is not steering people to a product. You know, and that's why if they use 10, well, there's one that's at 11, so so you kind of gotta be careful. And also that working from the general list on a provisional list, I mean, the data's good on the two, but they're not in the general list yet.
You're essentially asking someone to buy experimental technology to meet a regulatory limit for it, if you're asking from the provisional list.
Yeah.
right. Yeah,
So, yeah, so you might want to say the best available technology from the approved list or something like that. Anyway,
Yeah,
we'll deal with that when we deal with
I
it.
think that's one we can definitely solve with the best language possible without steering. Or getting boxed in that, we say you gotta have these type of systems and it should be a 3-year waiting list to get them installed. That's not good either.
right.
That's true.
That is.
That's a good point.
It's something to consider. And
Yeah.
if I may comment, I don't think the 19 milligrams per liter are a bad system. So, I think that's, we're at this time trying to do better than that. And that's been the benchmark for about 30 years now with that. But I still think those are good systems. So. And what I believe the state is going to be leaning towards doing the bannered systems in Nantucket Harbor Watershed and Nantucket anyways, so whatever the state says, we need to follow that. Of course, we can only go stricter than that, but there's nothing stricter to go.
So in other words,
than that.
if the state mandates something.
Yeah.
It has to be done,
Yeah, it has to be whatever level that the state
right,
says,
of
so,
course.
so that's just food for thought. I thought that was gonna, we'd kind of know about that really at this point in time, but as I always thought that was the intent, but, sure the state's very busy as well, just as everyone too, and we'll see when that comes. But I think that's generally, I think Don Bracken commented and said that, we all thought that was gonna be this was gonna be the state thing, and they just did focus on Cape Cod, so, particular Falmouth and, Mashpee and those areas, so. Chatham.
Okay. Great, well,
No, I'll meet with John. We'll tighten up the calendar. What's gotta be done when after we get back from Housetown Town Council needs to have something ready for the October 29th issue of the Inky.
yeah,
Begin our public notification process so that we can vote on it at the November meeting. 20th, what that is.
all right,
Okay.
Yeah.
great. I think,
And we extended the moratorium, which was the goal of the meeting, to 60 days. So that was really our goal for the day, was to kind of get that cleared up a little bit, have a direction or a rationale as to why. So we did good.
Motion to adjourn.
Second.
all in favor? Aye. All right.
You got very gentle around.
What does your phone do?
Oh, it opens up.
I saw you and I was like, what in the?
Yeah, no, I'd spend enough time on my phone, the bigger screen is probably worthwhile.
Okay.
Wow.
He just never got rid of his flip